All right, guys, welcome back to Underground Science. In this video, we'll be talking about prothrombin 20210A. Okay, so let's go and get started. So this occurs due to a mutation. Okay, it's actually a point mutation where you get a conversion from guanine to adenine, all right, in the position 20210. Okay, that's why it's called prothrombin 20210A. Okay, so you get a point mutation from guanine to adenine, all right, in the position of 20210 in the prothrombin gene. Okay, so this occurs in the prothrombin gene. Now, when this mutation occurs, this leads to an increased prothrombin mRNA stability. So the stability of prothrombin, right, mRNA increases, which means, and we know what does mRNA do, right? We translate mRNA to protein. So that means you get more prothrombin production, okay, in prothrombin 20210A. So if you get a lot more prothrombin levels in your plasma, prothrombin can get converted into thrombin, and we know that can lead to clot formation. So in this disease, you form clots, right? You're in a hypercoagulable state. So let's read what we have here. We said the same thing where this mutation leads to more prothrombin production, which leads to having a hypercoagulability, leads to you being in a more hypercoagulable state. So increases hypercoagulability. Okay. So what are the clinical features, right? So it's going to be based on the fact that you form more clots. So if we looked at thrombin, right? Or if we looked at the fact that we have more prothrombin now, we know that, right, due to the point mutation. More prothrombin means more thrombin, right? And what does thrombin do? Thrombin has a lot of functions, okay? Remember, thrombin converts fibrinogen into fibrin, okay? So you form more fibrin clots, right? So you form more fibrin clots, and then thrombin can also activate factor 13, who then stimulates fibrin cross-linking, which is important for forming stable clots, right? Thrombin can also activate factors 5 and 8, right? And even activate factor 11. Okay, so that's going to stimulate, that's basically a positive feedback, making the coagulation cascade occur more, leading to more clotting. And remember that thrombin, right, can stimulate platelet aggregation. Okay, stimulates platelet aggregation. So more platelets come to the area and stick to each other, make the clot bigger, and so that this results in stopping stopping blood loss, right? Then also thrombin can bind to thrombomodulin and become an anticoagulant, right? It can take part in an anticoagulant role, which when it does, right? We talked about this when thrombin binds to thrombomodulin, right? Thrombin it can activate protein C, which protein C then inhibits factors 5 and 8. Okay, so thrombin has a lot of functions. Now in prothrombin 20210A, right, you get a lot of prothrombin, which means you get a lot of thrombin, which means you get more clotting, all right? So you're in a hypercoagulable state. So why is this bad, right? Well, if you're forming more clots, you have an increased risk of deep vein thromboses, all right? And if that deep vein thrombosis dislodges and goes to your right side of your heart and into your lungs, you increase your chance of getting pulmonary embolisms. All right. And then of course, if this clot that we're talking about forms in a blood vessel supplying your placenta, right? Then you have an increased risk of miscarriages. And because in this disease, right, you have more clotting, right, due to increased levels of factor 2, for example, right? You can manage this by giving anticoagulants. Okay, and then if we're talking about, of course, the PT and PTT, right? The PT and PTT, we're not, we don't have a deficiency in clotting factors here, right? So the PT and PTT would be normal. Okay. And so with the bleeding time, because we're not deficient in platelets or nothing's wrong in our platelets, right? So, like, for example, Like our glycoprotein 1B, 2B, 3A is working fine too, right? And we don't have like thrombocytopenia or something, right? Severe thrombocytopenia. So our bleeding time would also be normal. Okay. So as compared to when we look at something like DIC, right? For example. So that's basically it, right? That's prothrombin 20210A. You put you at a more hypercoagulable state. You form more deep clots in your veins, like DVTs, pulmonary embolisms, and increase your risk of miscarriages too. Okay, so hopefully this made sense. Hopefully it wasn't too confusing. Thank you guys for watching and see you guys in my future videos.